interrupt your program to bring you this important podcast. How to 911.
Can you put me out of service on a podcast, please?
Hey guys,
Hi everyone.
I'm Sammy.
I'm Erica.
We're popping in today for you guys because we told you we'd give you an update and we're following up on our word.
Here's an update.
Here's the update. So, the stay-at-home order for Colorado has been extended to the 26th of April.
Just in case someone's
maybe June.
listening to
I didn't read it very well.
Later.
I'm just kidding. It's definitely until the 26th of April, so almost till the end of this current month that we are in of 2020. Also, the City of Loveland businesses are also extending to April 26th of how long they will be physically closed.
Right, so like restaurants and things like that, is that what you mean?
No, I mean, like, I just, like records, utility billing.
Gotcha. Okay.
Those, like, the
Like the
actual
departments.
city department businesses. But also, I feel like businesses are probably included with that, like restaurants.
Yes.
And such. So because of that, we just want to remind you guys that you just need to stay healthy.
Yes.
This is the only way we're going to be able to be on top of this, except for being at home. Stay home.
Stay home.
Please stay home. I cannot stress that enough. I see so many people out. I feel like traffic is the same.
Yes.
I feel like everything is the same. Like, for the first few weeks, I feel like, traffic was down. I didn't see a lot of people. And then I feel like people aren't taking it as seriously as they were.
Right.
And now we're going to see an increase of illnesses from that, possibly. I am not a fortune teller or a person that sees into the future, so I can't tell you for sure.
Which is also a fortune teller.
I just like to give different names for the same thing.
That's exactly it.
Why am I doing this?
I love it.
Oh.
So, stay home.
Yes.
Wash your hands. If you have to go out.
Don't.
And you still can.
Just don't. I'm just kidding.
You can still go to the grocery store. You can still go get your medications.
Mm-hmm.
You can do the things that they're considered essential. But limit it. If you have to go out, maybe wear a mask.
Right.
Put that on.
It's for not only your health, but other people around you, because there are people that are asymptomatic, which means they either don't show symptoms or show mild symptoms. And if you don't know what it is and you're going around thinking, oh, it's not that bad, I must not have it, then you're spreading it to people. So, or vice versa. Yeah. So you don't want to be the person that is healthy that's around a person who doesn't know they're not healthy. I feel like the more I talk about this, the more I'm just like thinking generally for all illnesses, we should just stay home. Never leave the house. Just never go outside again. It's a dangerous world.
Stay in.
Just stay in. Car accidents would stop.
Yeah.
It's probably the only perk I can think of. I'm sure there's other perks, but don't. Just listen to the stay-at-home order for now, because I know that being at home is kind of a big bummer.
Yeah.
Especially for such an extended period of time. Especially when someone's telling you to do it. That's just not fun.
Right. If it was voluntary.
Right. I voluntarily have stayed at my house for the last over 20 years of my life, and now that I'm being told to stay home, I want to go do things, and I'm like, what is wrong with me?
I'm not that way at all.
No?
I voluntarily stay home, and I'm like, yes. Everyone has to stay home.
Yeah, I guess.
Just do it.
Yes. If you do have to go outside, just try to be aware of 6 feet as well, including if you're with your family, like walking around. Be aware of, like we said before, the parks are closed, so that means that, you guys shouldn't be going there for, like, playgrounds.
Right.
Or, like, basketball, because, like, obviously, in those small, compact areas, you can't abide by the 6 feet rule. Also, like, can you imagine how many germs are on a playground? Which is good for boosting your child's immune system, just not right now.
Right.
So
wait until this is over.
Right, wait until this is over. Then I know currently, as of today, Mahaffey Park, the skate park, is allowing up to 10 people. And a lot of people have been calling in because there's people at the skate park and everything's closed, which makes sense because for a while there I was like, okay, why are there people at the skate park? But one of the officers stated that there's a sign on there that says they're allowing 10 people, and I think that's because, like, on a skateboard, like, are you really going to be that close to somebody?
Right.
Unless you, like, crash into them, which hopefully you're a little bit better at skating than that if you're at a skate park.
Maybe
but
skip the skate park if you can't.
Yeah, if you're not good at it, don't do it right now. Now is not the time to learn how to skate, because then your friends are going to be holding your hands, and that's not the 6 feet. No. So just think of things like that that kind of make sense when it comes to the rules. But otherwise, if you have any concerns about things being open or people being anywhere regarding the public health order, regarding the stay-at-home order, call the health department. Yes, that's the word that I wanted to say. Or you can go to somewhere. Isn't it Larimer.org?
Yeah, Larimer, and I think it's like larimer.org /
something.
Well, the stay-at-home order is larimer.org / health / stay-at-home order with dashes.
Yeah.
But if you just Google Larimer County Department of Health.
Yeah.
Or
Larimer.org.
Use a search engine.
Yeah. We're not promoting Google, but if Google wants to help us out, that'd be great. Are you listening right now?
Are you?
Are you? I'm sure you are, actually. So one of our phones, I'm sure, is spreading our secrets.
Yeah, it's mine. Mine's the Android.
Something that I want to talk about to kind of clarify some things with you guys with being at home. I understand that being at home means that if you have children, your children are also at home with you. They are going to be home burning off the energy they have because they don't have anything else to do like anybody would. So they might be getting into toxic things, they might be getting into dangerous things, so just kind of be aware of those things which are toxic, like prescriptions, plants. I used to eat my plants growing up, so yeah, it's weird. My mom called poison control a lot, and I don't know why.
Did it taste good?
Apparently. It was very little. I have no idea. Maybe I just did it because I saw how worked up she got, and I was like, I like this.
I'm doing this.
Yeah. I have no idea. I have no memory of it at all, so I'm just going by her word.
Oh, okay.
But there are things that are toxic to children, so just be aware of those things. Like, try to monitor it, make sure, you want to keep your kids safe. And on the line of poisonous things, there was very interesting statistics / research that was kind of brought up to me at work one day. We were just hanging out talking about the Rona, as we do. And one of the dispatchers said that the CDC or somebody, I don't think it was CDC. I'm going to link the actual article in the description. Ignore what I said about the CDC. But there was an article that stated that there was a Colorado center that has seen 20% increase in calls involving household cleaners, which when I read that article, it basically was saying that people are calling in wondering if it's not funny, I'm sorry, wondering if they could drink bleach to like prevent them from getting the virus and or cure them from having the virus. But not just bleach, like cleaning products in general. So if you genuinely don't know whether you should put these types of products into your body, you have every right to call poison control because they would be the ones to know. But just know that chemicals of that nature you should definitely not put in your body. If you feel like you have it, call your doctor. They'll tell you what to do, and they will tell you what you should be taking. whatever medications. I don't
Yeah.
even know. But
yeah.
they will be able to help you out a little bit better than seeing if you should ingest
Right.
things that probably won't even taste good to begin with.
If you have to if you're using it to clean, maybe don't put it in your body.
Right.
I mean, with the exception of, like, you can use apple cider vinegar to clean everything.
And, like, citrus,
Yeah.
the acidity in that.
Baking soda, whatever. That natural stuff.
Yeah,
But
natural things.
yeah, but if it burns your nose when you sniff it, don't drink it.
Like Tabasco.
Ew.
Delicious. Maybe I should start drinking bleach. It'll start giving me that spice I've been looking for in my life.
Clear out your sinus cavities.
Yes.
Please don't.
Yeah, please do not do that. That's so bad. That's so bad. That's how people die.
Yeah, don't. Oh, man. I cannot, like, it probably, like, I can't even imagine what your insides would feel like.
I mean, I can imagine it's like burning and melting and...
Well,
I know. Okay.
just don't do it.
I'm gonna have to censor this episode. Are you okay?
I couldn't swallow. I was like, ugh.
I thought Erica was gonna throw up on me for a second.
Man,
Okay.
and how sad would we be having to take a 911 call from someone who's like, I drank bleach. And then we'd have to think, oh my goodness, what?
We're gonna think it's like a suicide attempt.
Yeah.
That would be my first thought. I wouldn't have thought that you were doing it to help yourself.
No.
Or in your idea of helping yourself. Yeah.
Okay, so don't drink
So
bleach.
just don't do it. Gosh, please don't. Also, something else that I would love to talk about is that because we're all stuck at home, last time we talked about how mental health is affected by staying at home and being isolated, but that's not the only thing that's being affected by this. So domestic violence situations we know exist in the world. We know they're not good. We know it's just not good. I don't know any other way to explain it.
Mm-hmm.
So if you or somebody you know, somebody that you love, somebody that you care about, somebody that you barely know, whatever it may be, if you know that they or yourself are stuck at home with an abuser, please reach out, because like I'm sure this time being stuck at home, not being able to go to work, not being able to go get coffee, go get groceries, I can't even imagine the anxiety and the everything else that it's causing. That your freedom, whatever freedom you did have or they did have, has been kind of taken away.
Yeah.
So we have some resources for you or somebody that you love. Here in Loveland, we have what's called Alternatives to Violence. Their office phone number is 669-5150. And I'm not sure if they're in office working or if that's getting forwarded to a voicemail or another phone, but that is what I found online from their COVID-19 updated information. So it goes somewhere. So even though it's an office number, don't think that it just is going to nobody. It's going to somebody. I just don't know how that is working for them exactly. And they also have an after hours hotline that you can call that's basically 24/7 from my understanding. And that is 970-880-1000, which is 1000. I have problems with zeros, so I'm sure there's somebody out there that does as well.
You never know.
Also, if they are not in Loveland or in the very close vicinity of Loveland, there is the national hotline for domestic violence, which is 800-799-7233. Or if you're just looking for further information, you can go to thehotline.org. Or there's also this awesome tool, because we know that in domestic violence situations, the victim is not always able to talk when they are in situations where they are unsafe. So there is a text line for the national hotline, and you just text LoveIs as one word to 22522. And I'm going to say that again because the way I said it is a little confusing. The number is 22522. And also you can always call 911 or you can text 911. We haven't covered the text to 911 episode yet, but it is coming. So keep a lookout for that, but you can text to 911 if you are in a situation in which you cannot talk.
Mm-hmm.
So yeah.
And along the same lines, child abuse calls are down because the kids don't get to be seen by other people. So if you happen to know of a neighbor, you're concerned about them, reach out to
CPS?
Yeah. It's like, what is that called?
Child Protective
DHS?
Service?
Yeah. Okay. So Child Protection in Larimer County to report child abuse and neglect is 970-498-6990 or 1-844-264-5437, and that's 844 CO for kids. So like Colorado for kids.
That's cool.
Yeah.
So it's for the whole Colorado area.
Mm-hmm.
It's not just for Larimer County.
Yep. I think
That's really cool.
Yeah. So even though we're apart, still gotta watch out for each other.
Right. I just want to reiterate with everybody, if you have any concerns about what's going on with the virus and that's going on with the mandations that Larimer County has put out for the city, such as businesses that are essential being open and businesses that are non-essential not being open, and parks and everything going like that, please get a hold of the health department, because they are the ones that are following up on that. They are the ones that are citing people for that. They are the ones that are creating those rules. So if you call us, we will refer you to them, because we aren't completely aware of what exactly they are looking for.
Right.
And or what they are. I was hoping you'd finish it for me.
No, I was like mandating like their rules and like their stipulations.
Yeah.
So we'll help them out.
Right.
But they're the ones that take the reports.
Right. I feel like that's it.
That's it.
It's too easy. Do it again.
Starting from the top.
Start from the top. Okay, well, that's pretty much it. We might be updating you guys again. Who knows?
Hopefully not.
I know.
If you stay home, we don't have to update you.
Right. And again, if you have any questions regarding anything that we have said that the health department cannot help you with, or if you have questions about the police department in general or dispatch in general, like the things that we can answer, you can email us at howto911 without the colon at at cityofloveland.org. You can also follow us on Facebook at Loveland Emergency Communication Center. And like I said in the last bonus episode, how we were working on getting an Instagram, guess what, guys? We succeeded. So if you haven't already followed us on Instagram, because I've been posting about it a lot on my personal Instagram, I'm sure my friends are waiting to unfriend me.
Hi, Sammy's friends.
Yeah, I know. Hi, friends. Thanks for being a fan. My only fans. But hopefully this reaches the community sometime eventually. Anyways, we have an Instagram, and it's How-To-911 Podcast. So, super easy. Everything's pretty super easy. Next time, we will have the important topic that we've told you about 2 times already. So, hopefully you've listened to those. Otherwise, this is the first time you're hearing it. And that it's a second PSA, will be posted on the 15th of this month. Anyways, that episode is going to be What Do 911 Operators Do? Which is, I think, the most interesting part, because I don't think anybody really understands the behind the scenes. Okay, that looks better. Sorry guys, we're having technical difficulties, so if it's a little choppy between whatever just was played into now, I apologize. But that's everything we need to cover with you guys. The huge that we have already said. Just talk to us. Yes. Reach out to us. Yeah. That's what we're here for. And until then, know where you are, know your phone number, and tell us exactly what happened.